Anybody that's familiar with healthcare in New York has been familiar with the important role that MEETH played in the delivery of care in New York.
In 1869, shortly after the Civil War, a group of 17 philanthropic New Yorkers established a free clinic and 13-bed hospital for the poor in a rented 4-story brownstone on East 34th Street in Manhattan. The hospital, initially named the Manhattan Eye and Ear Hospital, was supported entirely by donations. The hospital grew quickly to meet demand, and in 1881, after outgrowing its original home, moved into a 75-bed hospital at Park Avenue and 41st Street. Even as it expanded, the hospital remained philanthropic. By 1903, physicians were treating close to 28,000 patients a year. The hospital's reputation grew alongside its physical plant. In 1904, the board of directors had added the word throat to their name, establishing otolaryngology as a new specialty. In 1906, the institution moved to its current, larger location on East 64th Street. Over time, MEETH evolved into a world-renowned center for patient care, research, and education.
MEETH is truly a unique place. When I first came here in 1984, I thought this was the most amazing oasis in New York, and all driven around a very simple mission, which is care of the blind, deaf, and disfigured. That's been MEETH's mission through both its ups and its downs.
In late 1999, the situation arose where the board thought that they would sell the hospital to real estate developers.
During these dark times, there was a group of us who felt that this was an awful thing that had just occurred, and deep in our bones, we just couldn't let this happen.
Several physicians, and I was one of them, challenged that idea. The Attorney General ruled that the hospital could not be sold for real estate development.
Lenox Hill, along with a number of hospitals around the city, competed to take over Manhattan Eye and Ear, and Lenox Hill did.
Lenox Hill was a fantastic choice, as they were able to come in and help this institution maintain itself and grow over the next 10 years until it merged with Northwell.
In 2010, Manhattan Eye, Ear, Throat Hospital joined Northwell Health, and it really started what I would call the Renaissance.
It wasn't clear to us in the beginning how MEETH would play a role for us in our Manhattan strategy. All we knew was that we had to preserve the name, we had to bring back some of the legacy programs that were native here, and we knew that if we could do that, that we would be very successful here, and we have been.
The rebuilding of this institution has been both in terms of programs, but equally impressive in terms of the renovation of the building.
The place needed a renovation, and Northwell has provided that, but it was really in the essence of teaching and research that they made the most important contributions to our development.
Northwell has provided us with research capabilities which are not creating any revenue for the hospital, but are improving the lives of patients.
That is what really MEETH is all about. It gave us the opportunity, based on its history and excellence, to do something that's turned out to be absolutely magnificent.
One of the unique things about Manhattan Eye and Ear, and to be honest, one of the reasons why I joined the department, is because of the uniqueness of the people working here. This is a very family, scientific-oriented department, and with the support of Northwell, has made this institution, Manhattan Eye and Ear, certainly a pleasure to work here.
MEETH is an extremely important core part of our infrastructure of healthcare delivery in Manhattan. So MEETH doesn't stand alone. It stands as part of an integrated network of services.
Thanks to the support of Northwell Health, as an institution has supported us tremendously and has bring a lot of value, not only regionally, but nationally.
I don't think any of us who originally sat down and talked about coming back to this institution could have ever imagined where we'd be today.
Here at MEETH, we are maintaining our original mission, but we're much more than that today.
The future for MEETH is very bright.
We're celebrating our 150th anniversary. I think we're just getting ready for the next 150 years.
As we celebrate 150 years in this prestigious organization, we're now in 2020, and we're going to have the vision to look to the next 150.
You get this unbelievable, positive, optimistic feeling that this is a place you want to be. This is where you're going to get the best medical care, and that's what makes the whole thing very, very, very successful.